Did you know that about 1 in 8 women will develop breast cancer in their lifetime, according to the American Cancer Society, making it the most common cancer in women alongside skin cancer? Welcome to Ways2Wellness. I'm your host, Summer. We are here talking with a cancer survivor today to hear about her story and do some questions and kind of let you know about some alternative ways and other things that she went through that she want to share her story. We have Janene John with us. Welcome, Janene.
Thank you. Janene John, I'm proud to say I'm a two-time cancer survivor. I first was diagnosed in 2014. I had a lumpectomy where the cancer was situated, a small lump. And again in 2018 was re-diagnosed with the same breast with another lump and had a double mastectomy to really be more aggressive on the second cancer.
So, Janene, on the first cancer, if you don't mind me asking, were you always doing breast exams yourself, or just waiting till you went to your doctor's appointment?
I was historically always doing my breast exams. I had, several family members on my mother's side that had some form of cancer. I had one aunt that had breast cancer. And so quickly was aware from my own providers that I needed to be diligent. In the case of 2014, however, just to kind of back up, I've worked in healthcare for many years as a HR executive, and I was working in a healthcare system and was basically putting off my mammogram. I was using excuses that I was busy, and a lot of the providers I knew. So working in a healthcare system. And so I was very fortunate. I had a great OB who said, "You will not cancel on me again. You will get in here and you get this mammogram." Because at that point, I was probably 6 months late of getting my annual.
Well, that's good, because what we know too is that you had a proactive provider who was aware that you haven't been going. And sometimes we don't get that, which is why we're talking about this awareness and alternative awareness, because when you don't have maybe that particular type
Mhm.
of OB or doctor, you yourself are able to, test yourself and say, hey, I felt something. I know something's going on, and being able to go in. So then knowing that your screenings are important. Can you share with us some things far as like pain or after your surgery, some of the things that you may have went to or experienced that maybe the viewers may not be aware of?
Yeah, I really want to go back a little bit where you made a comment about having a great provider. In my cases, I never felt the lump.
Okay.
So it was very important that that mammogram occurred because my lumps, the two that in respective of this conversation were always hidden behind another lump. And so they were not palpable where I could feel them. I had very dense tissue. So it had to be picked up on the mammogram. So I wanted to say that because even though you do your annuals, you do your breast exams, self breast exams, you not only you may not feel the lump. It's important that you get the mammogram.
So I want to pause right there when you said it was behind another lump. The first lump, were you aware of that lump that was there and you felt that lump, or it was just behind another lump that you didn't even know behind?
Yeah, it was behind another lump that I couldn't feel. The breast cancer was about 2 centimeters diameter, so it wasn't even large, but it was hiding behind a cyst, which I had in the breast, right?
That was
So
my
it was,
next question,
yeah,
was, so now they kind of, when you have a cyst, it's like, oh, it's a cyst. So you kind of get to the point where you're like, I already know what that is. And so it can be hiding behind other things.
absolutely.
And thanks for sharing that. That's where I was getting with that, was to find out what the first lump was.
Yeah, and I had a aunt that used to have a lot of She used to have a lot of cysts and
Okay.
fibrosis, and she would explain. She was a nurse, so for me, to your point, it was almost like, oh, it's probably just a cyst when they found it on the mammogram, because
Okay.
I had never had any abnormal mammograms. But unfortunately, in 14, it wasn't just that. They did do a needle biopsy to aspirate some of the
Okay.
fluid within the lump, and basically that's how they found out. You asked the question about pain and after the surgery. Having a lumpectomy in 2014 wasn't as intense as my double mastectomy. I mean, it was a small incision to remove. Again, remember my lump was only 2 centimeters, so it
Okay.
wasn't a large incision. They did test the walls around the tumor just to ensure that there was no metastases. I was very fortunate in 14. It was called early. There was nothing, I didn't have to do any mastectomy at the time. I did have radiation, just to ensure that the margins remain clear. And then, of course, they up your breast exams a little bit more often because at that point I was annual, like most women. And then I had to do it every 6 months just to ensure that there was no new growth in the breast. Really minimum pain. Of course, anytime you have surgery, you may have some little soreness around the incision. I think I was out for maybe a week and I was back to work. I just couldn't do any heavy lifting, things like that. But I worked in the office, so it wasn't really a hardship for me.
So also when you're talking about this surgery, can you give us like the location? Was it near the nipple area or was it more in a flat area? Because I've known a lot of women with breast cancer have stated that it was in an area where you stated that it was by a mammogram, but sometimes it's in an off area where off to the side that maybe is undetectable.
Yeah, mine was off to the side. To your point, it was not close to a nipple. And I was surprised that I didn't feel it because at that point I had very large breasts. I was probably a double D, and that might be the reason too. I was such a large individual that it may have been so heavy. My breast may have been so heavy where it just didn't show. I don't know. I'm just guessing at this point. But yeah, I was off to the side, so I had a little incision, probably about this big, to the side of my breast that they went in. And pretty much that was it. In my mind, I thought, okay, we caught it early. It's great. I got it before it got too large. I didn't have any infiltration in the lymph nodes or anywhere else. So there was not a lymph node removal at that point.
Okay.
Good.
So let's talk about when you got to everything was clear and how many, but you said until 2018, correct? So talk about how you got it identified or even went back. Were you still doing your mammograms regularly in between there? And
That time around, I wasn't playing. I said, I think it doesn't take me long to learn a lesson. I was still working in healthcare, and I will say, you know, I think I had an advantage working in healthcare. I was always surrounded with great healthcare providers, from my physicians to the nursing staff. I was very closely connected because I was an executive for the healthcare system. So people knew me in the healthcare arena. So I couldn't get over, even if I wanted to in some respects, because was working across from CNOs, chief nursing officers who knew me personally. And we always talked about health and wellness and taking care of ourselves and, how we can be our best versions before we can help other people. So I was very diligent at that point. Went in for a normal mammogram, and again, something showed up. And again, same breast, thought maybe a cyst again, going through the process, did the biopsy and found out actually on my 50th birthday trip that it was positive again for breast cancer. And it was in the same arena of where the breast cancer was before. And the reason why we knew is because they had placed markers in the breast to track the areas of where the breast cancer was. So we knew where the marker was from the old, and so it was right in the same area of where the breast cancer. The questions I always asked was, could it have been still there? We just didn't catch the margin, and you don't know. I mean,
no, you don't know.
about that. So, but it was weird in some respects that it was in the same breast. So at that point, I knew I couldn't keep the breast. It was too much of a risk to continue on with trying to just do a lumpectomy and go back in. And I struggled even taking the second breast off, to be frank. And I talk about this in a book I'm writing, is that as women, I don't know, for whatever reason, we are attached to our breasts. They're attached to these limbs. And I waited till 2 weeks before the surgery to make the call to take both of them. And it was, again, I had a great physician who was a good friend of mine who said, what are we doing? We're going to be back here in a couple of years, right? I mean, your probability of recurrence is higher than most. And she said, what are you holding on to? And I didn't have an answer.
Yeah,
there was
good
nothing
question.
I was holding on to. I mean, I'm not going to be already with one off. And then, so 2 weeks before, I was able to make the change and take two of them.
Yeah, and let's hone in on that point. I, as a breast health professional and seeing a lot of women with breast cancer and on breast maintenance, that is something that we deal with. I have had cysts and calcifications, which I talk about in my book, Unbalanced Boobs, of like, once you get familiar with what you're feeling, over time, your skills will be to the point where you can feel something different. But at the same time, you're like, I'm dealing with this, and we put a lot of emphasis on, I mean, it's something that when you have a partner, they enjoy. It's not like something we ourselves are like, I'm excited about this, but you know that your partner gets the enjoyment from it. So then you kind of struggle with that, or struggle with feeling like a woman. And as women, we deal with that with not just with our breast health, but also with fertility. So I can understand how, and kudos to you for saying, hey, what am I holding on to? That whoever's with me, whoever I'm married to, my partner, whatever, that they love me in spite of this. This doesn't identify me, and my breast is not my identification. And you can always get implants or other things that make you feel comfortable, but it should never make us feel ashamed of having, our breasts removed if it's need be. So thank goodness that you took your necessary measures to make sure that you stayed healthy and you stayed here with us. So I'm grateful for that. I do remember when you got diagnosed for the second one, and we wanted to make sure that we celebrated you. And I'm so grateful that here in 2024 that we can still celebrate seeing your beautiful face.
Thank you, my friend.
Oh, you're welcome. I want to get to after that session. A lot of times, as a massage therapist and breast health specialist, I see a lot of people with either pain or scar tissue or restrictive mobility. Did you have your lymph nodes removed on the second time? If you did, are you dealing with any lymphedema type of issue? And what have you done alternative wise, if you have done alternative wise, to kind of help ease your transition after the second surgery?
Yeah, no, God was good. I've not had any lymph node removal, so I've not had any excess fluid. If you recall, you actually helped to do massage therapy for those tissues, because when those were removed, I had to get ready for implants. But so mine was a little different too. I did the abdominoplasty, where they used the abdominal tissue to refill the breast. And it's a well-known procedure now. It's almost like you get a mommy makeover while you're doing a mastectomy. I had very limited body fat in the stomach, so I knew I was going to go to a low BC, which I was happy with because of being a double D.
Of course.
My dream state, right, in the first place. And I had complications doing that. So, but still, and yet I did have a lot of tightness around the chest area, the chest walls. You aided me in making sure that I had some of that tissue to start kind of softening up and loosening up. But yeah, I actually had a lot of complications with doing it. So I would say my plastic surgeon said if out of all the things that could have happened, it happened to me on that procedure. It was unlike that I would have all those different complications, but I ended up having them.
So are you still having some restriction, or how's your scar tissue and your tissue feel now after years later?
Yeah, I have scar tissue where the incisions are. I'm a person that historically has keloid in my life.
Okay.
I started when I was a young age, keloiding in my ear lobes. And then anytime I have a deep cup, I have scar tissue or keloids around the breast incisions. And so I do see a dermatologist to do cortisone injections occasionally to soften up the keloid.
Okay. And so that is another traditional thing that you can go see a dermatologist to do that. I'm glad you told me, because I think that we need to get together to help you with that. One of the things that happens when you have keloids or when you're having so much scar tissue, you get restrictive blood flow and you get that restrictive lymphatic flow. And since you didn't have any lymph nodes removed, you want to make sure that you're still getting that nice flow through the tissue to kind of keep that softened up. So that is one of the things that I like to help with women, that anytime that you have surgery, and not just on the breast, but also on the stomach area where you had that, you want to make sure, because now your lymphatic flow can be blocked. Go on your lower abdominal area through the inguinal area where you can kind of have some restriction through there. Do you have any swelling that you have in the legs sometimes, or you deal with any kind of, edema or anything like that, whether it's small or large in the area?
Not in the legs. I will do occasionally in my hands.
Okay.
They will swell, and it's not often, but I can tell when I'm holding fluid, right, in the hands, so forth, but not so much in my feet. I was told to watch for, those kind of reoccurrences, watch for underarms if I started getting pains, those things, because again, they watch for any spread thereof in the lymph nodes.
Yes, for sure. And even having it in your hands, that's what we're talking about, some of that restriction that definitely will happen. from the breast area, even though it's in your hands, it's still a connective flow. And so make sure that I always tell people, whether you've had a myomectomy or just one or some tissue out there, you always want to make sure that you still having your lymphatic drainage. I know a lot of people, we kind of minimize having that done, but on a regular basis, I almost do maybe like 2 or 3 times a week that I literally just do my own breast just to make sure that I'm getting that flow. Want to talk about bras. So talk to me about, like, after the surgery or doing it, do you have some irritation wearing bras with this on your skin, or do you have to wear a specialty type bras, or, just talk to me about how the bra situation worked afterwards.
Yeah, for most women, they're taking the full breasts out, the 2 breasts out. Because I go back to, I had complications. So my breast was originally had tissue in it. They had my abdominal tissue placed in the breast. Within 24 hours of that surgery, the full mastectomy, the tissue being removed, the abdomen, while I was on the table pulling that tissue up, I ended up getting a blood clot in the left breast.
Okay.
And that was the breast that was unrelated to the cancer. It was just strictly the tissue coming. I had to go back to surgery within that full 24 hours to remove the clotting, because the clotting had restricted blood flow, oxygen to the brain and the heart. I coded because of that. They eventually, fast forward through a lot of the trauma, but they eventually had to go in and take that tissue back out of the left.
Okay.
I maintained the tissue on the right, which was the tissue for the cancer, but the left had to just remove it because it was too dangerous to keep in. So I'm now 1 breast flat. So I did have to go to they have special stores for people that are survivors of breast cancer. They call them mastectomy bras. And it allows you to have a regular forming bra with an insert of silicone breasts inserted into the bra. And they fit you for these bras, which is very nice. It fits you from now with your new circumference, because your size is different, and then your size on both sides. So they try to match it to fill in whatever's going on. If you're fully mastectomy, they'll try to give you equal and even breast sizes if you're one on, one off. It is costly. One of the things that I did do is I joined a foundation in donating and raising money for these bras for women. All insurances cover it. And they are about $50 to $60 a piece. So in some cases, women can only afford one, and then they're rewashing that one.
And over time, the intensity of it can actually reach out.
Yeah, so I had the bras for a while. So you remember, once you get a mastectomy, for those who are just hearing about this, there's months before you can even get reconstructive. So, because they want your tissue to heal, they want you to heal from the trauma of the cancer. And in some cases, if you're doing radiation afterwards or chemo, they want to make sure you're going through that cycle. So it was months before I could do it. So I had one insert, and then I had a bra that was specially designed.
Yeah, so what I'm hearing is, even then after the surgery, there is some patience that is required to dealing with this, and then dealing with the trauma, which is the word that we use, and you have to deal emotionally, physically, and spiritually to be able to handle what you're dealing with, not just the cancer, but the after effects that can happen, and then being fitted for the bras, and then being financially strained if you cannot afford the bras. So talk to me about, I want to just jump back 1 second about the foundation. Can you just tell us, is that like a national foundation? Is there a foundation that other people who are listening probably, like, kind of check in if that's something that they're interested in?
Yeah, actually, no. It was a privately funded foundation in Florida. A woman that is similar to my case. She had breast cancer, and she found herself that she couldn't afford the cost of the mastectomy bras. And so she was makeshifting a bra for herself. It was almost like when we were back in school, we were stuffing our bras. She said, she told me the stories, how she had to try to go to work every day and try to form a breast out of sports bras. And if you know, sports house have that insert. And so she wanted to help those who couldn't help themselves in this. And so
Awesome.
the mastectomy shop that I went to partnered with her, and she created this foundation where anybody that came to the mastectomy shop, they would get a discount if they agreed to donate once they had reconstructive, to
Nice.
donate the bras back to her. And so fast forward, we met and we would meet often. And working where I was working in healthcare, it was, kind of a great marriage. We were seeing patients all the time with the same challenges in our hospitals. And so we shared her foundation. We even donated as an organization, and I personally donated. And some of that was just really to continue to keep the replenishment of the bras on stock so that and she was posted in that mastectomy shop. So if there was a patient that came in there and couldn't afford it, they would connect to her and then they would get free bras donated to them.
Awesome. It's interesting how we've come so far
Yeah.
in breast cancer and breast awareness, where people just kind of like, oh, it's breast cancer, and we kind of throw it off. But at the same time, she's given people their life back. But I wonder why we don't have more of that. Should be almost like a standard where you don't even have to look in today's time for a place where you can get bras to kind of fit, or they, have something for you to have that. But thankful that her foundation was able to be able to help out.
I think you can do that for any mastectomy shop. If you go in now and you ask, how can I be a benefit to others that can't afford this? They are always connecting people and saying, you can even give it back to the mastectomy shop, and they give it to the individuals either cheaper or for free.
Okay.
I'm actually talking to some people here trying to pull together something in Atlanta where we can just have that, where we buy up so many bras and get donations that we can give those away for free. It's important because I think you talked about the trauma. This journey really is around the trauma in your mind. Hearing cancer, it takes you in a different place, right? I had a great interdisciplinary team of people, from my oncologist to my plastics integrative medicine doc, who talked to me about acupuncture for pain relief and the foods I was eating to get me ready for the surgery and after the surgery, to a psychologist who I had to meet with to talk through some of what I was feeling. Because it's really it's the journey afterwards that it plays with your mood. It really, you feel less than, you don't feel good about your body. You feel sick inside because you're either on some type of drug that's trying to kill the cancer. You're losing hair. You're going through a metamorphosis that people don't understand, but you're having to show up every day, and trying to put a smile on your face. And for a lot of us, you've got to go back to work too. You got to figure out that whole piece of it. And I think really having a psychologist and someone to talk to, or a support center. I went on the web looking for support groups of women of color. And I think that was where I started having concerns, because we don't always tell our story. Well, I found a lot of people, African American, that were willing to share, but I couldn't find people of my own background that was open enough. And so you need that. You need to be able to talk it out with people who have been through your journey with you.
Yes, for sure. And that's kind of what Waze2Wellness is. We're talking about alternative therapy. It's not saying that you're not going to have traditional care, but we are a complement to the additional. So I know that working with people, even when they were going through chemos and going through radiation, you might not do it at that particular time, but working with the wellness team can give you a different outcome, far as pain, far as ease of the medication going through the system, and all of that can definitely take place. So I want to say thank you for sharing your story, because I think it's definitely important that we learn to share. You never know who may be listening, who may be able to pick up on something that they haven't picked up on before, or found out some information that they didn't know. As we wrap it up here, is there anything else that you feel like that you want to share with some woman that you don't feel like is traditionally done? That maybe, hey, I wish that they would have said this, or I feel like this part is missing in that continuity of care.
I mean, I took advantage of probably more of the integrative piece. I did a lot of medical massage to really keep my skin good, because I knew I've had friends tell me as they were getting ready for their implant, they needed to stretch their skin. They go through that to stretch your skin, but part of that too is making sure you want to make sure your skin is right. So I did a lot of that. I did acupuncture
Good.
because I wasn't a person that wanted to take a lot of drugs, even though I had drugs in the process. But I literally would do acupuncture for pain relief. I also believe in getting your body internally right. So I had a great integrative medicine doc who talked to me about different herbs and vegetables to prep me for the surgery. I actually met with him a lot to get my food intake raw and workout. A lot of people said to me the way I survived it is because I had worked out like constantly to get my cardio up, to get my lungs to expand, to get things to move when you know you're going to go under anesthesia. So
Anesthesia.
those are all things I would encourage people is don't wait till your surgery, your mastectomy, to then for the fight, right? The fight goes before the surgery. Use everything you can get your hands on. I mean, I did a lot of research on the web. I, talk to people, but take that. I have a lot of friends that are in their journeys or just passing their journey. I gave them the same advice: is work out now, get your body right, get the food intake right. Don't do what you're doing today and think your fight is not going to be harder. Get your
Yeah.
body in a good space so that you can move through it. And then as for opinions, I know, our healthcare teams mean well. They're fighting this fight every day with us, but every patient is different and every approach is
Sure.
different, and really be okay with speaking up, being your own advocate, because I was fortunate again. I had healthcare professionals that validated me, but they knew when I said I meant something, I wasn't going to budge off of that. I didn't want you to take me down the pathway just because you wanted to take me. So I was really good about speaking up. Like I was able to save my nipples and do a lot of things that I was very adamant. I don't want to,
Yes.
tissue's my tissue. I really want you to save it. So just speak up. I think and get people around you that when you can't be your own advocate, that they can be your advocate. I think that's important. And they share your vision, because along with you, I had a girlfriend sister network that surrounded themselves around me, that even in my worst moments, they allowed me to have those moments, but they kicked me in the gear, right? They said, okay, let's fight, Jane. Let's go. We got to walk. I mean, even that was hard, like to get up and walk and to do things. It's like, come on, in order to get these lungs moving. So get a network of people, if I could just say that, because this journey is hard enough and doing it by yourself is just unbearable.
Yeah, that's so good. And thanks for those. So, as we talk about key takeaways, one of the things that we definitely want to take away from Janene's story is that get your mammograms and get checked to make sure. The other thing that we want to do is just to make sure that you advocate for yourself and speak up. You do some research and find out. You look in your community for places not after the surgery, but even before, like, hey, what are my options as far as my bras, as far as my alternative care, finding an integrative medicine. All this can sound expensive, but at the same time, you're already going through. So put the effort into yourself so that you can make sure that you have the best outcome. I want to thank you, Janene, for sharing your story, for joining us. And like you just said, it's a journey. Waze2Wellness is, I always say that health is a journey, not a destination. And so until we leave this earth, we want to make sure that our journey is complete. And we always want to do exercise, aerobic, and doing more things that we can do to kind of keep our circulation going and keep our lungs going, which is very good in what you stated, because it's very important that we don't really think about our organs that need to kind of contribute to not just laying on the table and letting someone else do the work. We still have to contribute as well. So that's part of the complementary team, is that you yourself is part of the team.
Yeah.
But thank you so much for joining us. It was a pleasure talking with you. And I hope that anyone else who was listening will be able to learn something and actually benefit either yourself or someone that you're working with and helping out, a family member or friend and supporting. But thank you for joining, and thank you for joining Waze2Wellness.
Thanks, Summer.
You're welcome.